Hey, my name is Michelle Fredenberg. I'm the Director of Quality and Reimbursement in the Healthcare Center. I'm a physical therapist by background. Today we're going to show you how to put a gait belt on in the correct way. So when you have the gait belt, the first thing you're going to do is you want to put it through the teeth side first. So it's going to go in through the teeth side and then out through the smooth side. And that's going to allow you to have better control over making sure that you have the gait belt snug and in place when you have it on a resident. You're going to come around, you're going to put the gait belt at the waist. And again, it's going to go through the teeth side first. And make it snug. And it's going to go through the smooth side. And you want to make it nice and snug. And if you put your fingers inside the gait belt, you want to have about 2 fingers in that gait belt. So kind of nice and snug to where you have some good control when you're holding the gait belt and assisting a resident. So let me turn just a little bit and demonstrate that 2 finger is what you're looking for. All right, so in this video, we're going to go over a 1-person transfer. So moving from one seat to another. This can be demonstrated from a hospital bed to a wheelchair or chair to chair. So the first thing you want to do is ideally you would have a setup where you're at close to a 90-degree angle. And the reason for that is you're going to have enough room for a patient's feet to move, for them to reposition themselves to the side and be able to reach for the armrest of the chair. So first we'll put a gait belt on, so you'll have them lean forward if they can help you. Okay, so you're going to have that nice and snug. What you would ask a patient to do is you're going to have them lean forward towards you, bring your body forward, yep, and then you're going to have feet positioned back just the way they are and have them help you to stand. So as much as possible, you want them to assist you with that standing. Have you sit back down for me. And then with your body, what you're going to be doing is you're going to position your body where you're close, and you're going to be bent at the knees and the hips, and using your legs to lift, legs and hips. So as we're demonstrating that, what you want to make sure you're doing is bending at the knees and the hips, not bending over at the back. And then you also want to make sure that we're not twisting as you're moving a patient from one seating position to the next, but you're moving your entire body. So keeping your spine in alignment throughout. Right. So the next thing we're going to demonstrate is fall recovery training. If you find a resident in a position on the floor, the first thing you want to do is assess to see if they've had any injury. If there's no injury and they feel comfortable with assisting you with getting up, then the first thing we're going to do is have them assist as much as possible in the process of getting up. So the first thing you'll ask them to do is if they can get into a position of being hands and knees, and then we're going to bring a chair close to them in order for them to be able to use that chair as leverage to stand up. This will allow them to help you as much as possible and put them in a position of having control over that movement, and it's also going to put you in a position of safety because you will have them assisting you as much as possible with that movement. So we'll go through and we'll demonstrate that. So I'll have you go to a place where you can get to hands and knees if you can. Okay. And then we're going to bring the chair closer to you, and you can use either the armrests if it's a little bit higher for you. And then from there, bring one knee up if you can, and then I'll have you push, and I'm going to help you stand up. Good. And then we can turn around and sit down. There we go. Okay. And then from there, you can assess to see if they've had any other injuries or need any additional attention. But the idea is that as much as possible, you're allowing them to do the work and you're just there to assist. In the next demonstration, we're going to go over lifting safety. Anytime you're doing any lifting activities, you want to use a couple different principles. So the first one is making sure that whatever object you have, we're keeping it close to your body as you're lifting. You're using your legs for lifting and not your back. And then you're also keeping items that are the heaviest at roughly your hip height when you're going to lift. So items that are lighter are going to go up high, or items down low should be the lighter items, whereas the heaviest items in positioning on shelves or things of that nature, you want to have them towards the middle, so that when you're lifting, you're able to keep that alignment as well as possible. So we're going to go over body mechanics for lifting. So I'm going to have you move in close to the box. When you go to lift, you're going to bend at your hips and your knees and pull the box in close to your body. Perfect. And then you'll back up. When you go to set the object down, you're going to make sure you bend at your hips and your knees. Keep that box close to you until you're ready to set it down on the ground. Perfect. All right, so from a body mechanics standpoint, you're going to bend at your hips and your knees. Pull the box in close to your body. Good. And then when you turn, you want to turn with your whole body rather than twisting at your back. Perfect. So today we reviewed how to put on and take off a gait belt, one person transfers, fall recovery, and body mechanics with lifting. So now you can go out and work safe.